Welcome back. You're watching News Center, and on this side of the show, we're going to take a look at some of the public health situations. Later on, we're going to have a presser by the SRC. We'll get you all caught up on that. But first of all, let's talk about this health situation that is being revealed in some of the reports that came out last year. And joining me all the way from Kisumu is Jackie Odhiambo, who's the ED for Nyanam, as well as a public health expert. Good morning, Jackie.
Good morning, Trixie. Thanks for having me.
All right, let's talk about the data that is and information that is hidden between the numbers of the data that is in the Kenya Demographic and Health Survey of 2022, and of course the Kenya Population-Based HIV Impact Assessment Report of 2022. When you looked at these two reports, explain to our viewers what you saw and how that translates to what's happening on the ground in terms of access to healthcare.
Thank you so much, Trixie. So I work with Nyanam Widows Rising, and due to that, we tend to focus a lot in evaluating these reports to compare what is the health situation among widowed women in the country compared to widowers, compared to other groups of women. And I think one thing that these reports have brought into light is how widowed women in the country experience greater health burden or larger disparity in terms of poor health outcomes compared to other widowers or other groups of women. So, for example, we can take HIV/AIDS, and one of the KenFIA report, the HIV Impact Assessment Report, shows that if you look at women of reproductive age from 15 years to 49 years, 35% of widows in that age category are HIV positive.
Right.
And that is really the prevalence across all categories. If you look at married women, it's around 17% in that age category. And even when you expand the ages and you go to 15 to 64 years, you still find like 1 in 4 widows in the country is impacted by HIV/AIDS. So there is that aspect of HIV prevalence, which these reports show a higher burden among widowed women.
And we're not just talking about HIV, also talking about STIs, sexually transmitted infections, right? So this data that we're talking about clearly points, I'm assuming it points to some societal problems that need to be addressed, because there is usually a situation on the ground that is intensifying the numbers of infections among a section of the women in the country. Could you explain to us some of the situations on the ground that are perhaps necessitating or facilitating the higher numbers of infections amongst this select group of women?
Yes. So I'm going to share a little bit more into that, Trixie, but to add on just these disparities in health situation for widowed women in the country, so the KenFIA report focused only on HIV/AIDS, but the Kenya Demographic and Health Survey report covered other aspects of health, including disability, including issues of gender-based violence. And if you look at, for example, their reports on disability, just asking from anyone here, issues around vision, hearing impairment, mobility. And even when you look at that, you find that the report shows 12% of widowed women reported having a significant disability. Compare that to only like 2% among women who are married, or like 1.5% among single women who are never married. So even if you look at disability and the different categories, there's a greater burden for widowed women. The same applies to issues of gender-based violence. 58% of widows in these reports were saying they have ever experienced physical violence, and around 30% have experienced sexual violence, and those are like the higher percentages compared to other groups of women, like married women or single, never married women, or even divorced, separated women. And so that's comparing widowed women with other categories of women. But even also when you compare widowed women to widowed men, to widowers, you still find the widowed women having greater disparities, inequities in these health outcomes. outcomes. So going back to your question around what could be the drivers, why is poor health outcomes so concentrated among widowed women compared to other demographics in our society? There are issues that drive this. So first, there is the stigmatization of widows that comes from the cultural context in different parts of the country, and the way we view stigma is that it is a root cause for poor health outcomes because of how it functions in the society. For example, when you are stigmatized, you get rejected, you get isolated, you get labeled. And widows have very many different labels, and usually when these kinds of being labeled, being rejected, being isolated, when all of these are happening to you, of course there's a way in which they're impacting your mental health, and how impacts your overall health. It also impacts even your access to healthcare. So for example, even some research reports showing that a widowed woman saying, well, if I go to the health facility and I'm a young widow and the male doctor knows I'm a widow, there's possibility that I could be sexually harassed or exploited in those situations. Then the second thing about stigmatization is that by reducing your access to relationships, it also reduces your access to resources. So for example, we know in our country that widowed women are often disinherited. And sometimes even not just land, but sometimes even your household effects can be taken away from you once your husband dies by your in-laws. And so in a way, you become a widow, and then you become even more impoverished. And so when you don't have a resource to meet your basic needs, then it also means you don't have resources to protect your own health, to protect yourself from even diseases, or even to access good health care when you need it. So stigmatization of widows is really at the root of many of these health challenges, in terms of like the drivers for the health challenges widows are facing, and the cultural norms that shape these experiences.
Okay. Now, of course, this is stemming from culture. You've talked about an element of poverty that comes from being disinherited in certain parts of the country, discrimination, the vulnerability from the society because they feel that they can take advantage of women because they have been widowed and they are on their own. And of course, these are things that I do believe can be handled. Do you feel like this is a burden that should be taken up by society at large, civil society, county governments, or even the national government? Who is responsible? Because the report have documented the problem very well, but what about implementing change or implementing things that will necessitate change?
Yes, I believe that all of us in the society at different levels have a responsibility towards making our communities, our country, a place where widowhood does not subject a woman to much more deprivation. So, for example, for the government, health insurance is one way of providing universal health cover and actually ensuring that widowed women have health insurance. Can be just one very practical way of protecting the health of the women who are widowed, and by so doing, of course, you're protecting the health of their children, who do suffer great by extension because of the experiences their mothers are going through. And I know, for example, in Kisumu County 2 years ago, the county had enrolled began a health insurance program they called Marwa, and even in that time we and a couple of widows in the organization tried hard to advocate for the inclusion of widows in a category that the county government had created as indigent households, so persons in the community that they felt were not able to afford the current costs of NHIF, for example, being able to pay 500 shillings a month. So there is a part of the government on providing social protection in that manner, but there's also a part of making sure that even the costs that are being put forth, for example, NHIF, the self-cover option, how can it be redesigned in a way that Kenyans at different income levels are able to enter based on their ability to pay, rather than just a standard number that is required for everyone, like 500 shillings per month, yet we know that there are many of households in our country, especially those led by widowed women, who will not be able to afford that amount in a monthly basis, but might be able to afford a lower cost if that was offered. So the government has a role in that aspect. Also, funding research to bring more light into the health experiences of different categories of women in our country. I think that the KDHS report we are talking about, and the KenFIA report, KenFIA only focused on HIV/AIDS. KDHS also touched on some infectious diseases like HIV, TB, and issues around maternal care. But there are other diseases like cancer, hypertension, diabetes that are also very much impacting many people in the country, and even widowed women. But we don't have clear statistics on how are different demographics in our country experiencing these health conditions. The importance of doing research on these is that we get to understand where the burden lies, and also figure out how then do we intervene in a strategic way that is based on evidence on where the burden lies, rather than just say we have this one policy that we are applying, all across, but we're not being sensitive to the different dynamics of even how people are having greater risks for these illnesses, and even poor access to care. So the government has a big responsibility, and I would say, Trixie, that for the rest of us in this, I normally say that every Kenyan knows a widow, and we need to change our attitudes towards how we view widowed women and how we treat them. I mean, if you are the in-law who has taken away a woman's land, her livelihood, if she's living in a rural, she depends on the farm to feed her family, and then you are taking that away from her. So you need to rethink, all of us, we need to rethink how we view.
Yes. Yes, Jackie, I just, now that you mentioned some of those things that people still do in the Kenya of today, perpetrating those acts against widows, I'm just wondering, since you work with widows directly, what are some of the stories of success, and of course some of more concerning practices that you have seen towards widows that you'd like to highlight, and what would you say to the general public in an effort to try and let people see that we can actually do better?
Yes, I want to share one very concerning issue of health that we are coming across even more often. As Nyanam, we work with widows, we view widows as leaders, so they are really at the center stage of implementation in our organization. And just last month, Trixie, we met with the widows who are community health volunteers, and just talked to them to understand what are some of the health issues that are happening in the households led by widows that are not visible or are being ignored by even different governmental agencies that need to provide protection. And what's going on, particularly in some of the households in the areas where we are working at, is that the children of widows are being sexually abused. So oftentimes you have this situation of widow inheritance, which happens in different cultures in our country, including where we work. But we're beginning to hear more stories of the widow inheritor who came into this house to have a relationship with the widow, also sexually violating the children, the girls especially. So there is a lot of issues of gender-based violence that is going on, that is impacting the children, and they are growing up in households that we need to shed more light on, and we need to really shed more light on that, and there's need for action to ensure that the children's rights are protected, and the children's future are not being violated. And what's concerning for us as an organization is that sometimes even when these issues are being reported to local authorities, then people bring them back and say, oh, we are neighbors, we are relatives, let's just solve it on our own in the community. But then ignoring child, it's just the child becomes the invisible, and people are just focusing more on protecting their face and all of that, but not looking at what is the right, what is the future of this child. So I think those are one of the many concerning issues that we come across in our work, but that's one that we really want to shed more light on, and to encourage widows, if this happens, don't keep quiet. Sometimes mothers also keep quiet, partly probably as a result of trauma, what has happened, they don't know how to express this, partly also, these issues of relationships in the family and in the community. But we do want to encourage those across the country that if such things are happening, please come out and speak. But also the local authorities, take the right action, protect the children that are being violated, do not protect the interest of the perpetrators. So that's one thing I wanted I would love to share, but as Nyanam, our work is holistic. We feel that to provide adequate support for widowed women, given just the different ways in which their lives are being bombarded by different aspects in the society, be it poverty, be it culture that sometimes is dehumanizing.
Yes.
Be it just the greater burden of being a single parent and figuring out how to play both the role of being a mother and a father. So because of all these challenges, for us at Nyanam, we provide holistic support. And I know there are many other organizations across the country who are also doing this work. And there has to be, absolutely, there has to be work around advocating for the women's land rights, so that, because that is much linked to their livelihoods and
of course opposed to poverty, and it will have a ripple effect on their access to health. Thank you so much, Jackie Odhiambo, for that very comprehensive look at how vulnerable groups, widows, are getting a raw deal when it comes to access to health services because of some of the practices, and that some are cultural, some are just basically societal ills that need to be handled in Kenya. Thank you so much for joining us. This was News Center. That's all we had for you. Join me at 1 for more news and updates from across the country. But for now, it's goodbye.